We are sometimes trapped by evil moments we least expect. Those moments can be marred by illnesses, be it infectious, genetic, or congenital. The lender of last resort is then treatment. We either self medicate or we go to the hospital, but oftentimes we treat at home with over the counter medications. When treatment fails, we then present to the hospital, which is a good thing and often we encourage that. But then, there are certain salient behaviors we do exhibit that are likely going to hamper on our chances of getting quality care. It is on this premise that today's episode of Your Health chooses to focus on the 7 common mistakes we make when visiting our physicians. In this episode, we are likely going to have 3 of those common errors and then we'll discuss subsequently in the next episode. Error number 1: requesting for investigation even before laying down our complaints to our physician. This is the common pattern things should flow whenever you visit your doctor. You lay down your presenting complaint, then you allowed yourself to be examined. After examination, the doctor will request for an investigation in line with the likely organ system that is probably being affected. At this point, you can say what is in your mind if in case you want certain investigation being conducted. The doctor will then guide you as to whether what you are asking for will help in your diagnosis or not. But oftentimes we do come and say, I want a general checkup. And to you, you think a general checkup means a test for malaria, typhoid, blood glucose, blood pressure, and urinalysis. But to me as a physician, I am looking at your head, your eye, nose, mouth, ear, heart, lungs, liver, etc. Of which if I have to examine you, you are likely going to sell your house and we will still not be able to fund for those investigations. Also, it will interest you to know that typhoid is just one of the 5 million trillion bacteria on earth. For the fact that you tested negative for typhoid doesn't mean you don't have other bacteria like E. coli, Shigella, Klebsiella, parasites like worms infesting your GI tract or even your blood. Error number 2: not wanting or caring to know your diagnosis or what you are being investigated for. Most of us visit the hospital as if we are going to buy tomato or some bread in the market. We fail to realize that it is our resources that we are going to be expending. So what happens if we don't have enough resources? So it is good that you speak with your physician, understand the lines of his thoughts, where those investigations leads to, how much they are likely going to cost you, and then prioritize where your money will not be sufficient to carry out all investigations. When a definitive diagnosis is being arrived at, make effort to know what you are being treated for, the drugs you are taking, and it's important you get it in your head, the names of the drugs you are taking, because you don't live in a place for a lifetime, and some ailments tends to be chronic in nature. So what happens when you move to a different location? Also, it's important to know that disease condition can change. For instance, you may have hypertension and you are on treatment for hypertension, but things can change. You start breathing fast when you walk small distance, your legs start swelling up, your right upper abdomen starts paining you. At this point, you need to know that this is no longer hypertension, but probably hypertension has resulted to heart failure. If you have this good knowledge that heart failure patients don't need enough fluid, anywhere you travel, you get to inform the people there in case you meet a less experienced health personnel. You let them know you are not supposed to receive much fluid. If not, you are going to worsen your condition. So point number 2, make effort to know your diagnosis and the medication you are taking. Error number 3 is that we often tend to deny our diagnosis because we think we have faith and by his stripes we are healed, or because we are trying to avoid certain medications. For instance, somebody with diabetes or hypertension can deny being sick because they believe that agreeing to having those conditions put them at risk of taking drugs from that moment to the rest of their lives. So they deny it and allow complications to set in. Others will claim they have faith, and by faith, they are no longer HIV positive patients. This is a life case scenario. Patient A was operated upon, told she may never give birth again. She quickly and hurriedly shut that doctor up with "God forbid." 3 years down the line, she returned back to look for the doctor as to why she could not conceive. Unfortunately, the doctor has left that hospital. Going back to her records, she could not access it because it was an electronic medical record system, which folder has already been contaminated with a virus. So all information stands erased. She has to start from the scratch. She probably could have saved a lot of money, but then this is what denying her diagnosis has led her to. Many of us are likely going to face similar case if we keep denying that yes, we have an underlying medical condition.